Dr. Zhitnitsky, let's talk a little bit about the yet still controversial fact about silver fillings or amalgam fillings, as they're called, good or bad. Should they come out? Can they live in? Should we put new ones in it? What's your take on it?
Well, the problem with silver fillings is they have mercury inside. And even though it hasn't been proven to have a direct relation to certain diseases that some people claim, my understanding is that having mercury inside your mouth couldn't be good for you.
That was something I learned when I was a kid. My mom told me not to eat the thermometer.
That's right. Do not eat your thermometer.
Thermometer, yeah. So what should we do?
Having said that, it doesn't mean that you have to rush out and replace every silver filling in your mouth. But with regular checkups, and since those fillings are kind of old, they do have a lifespan and they do need to be replaced. And if you're going to replace them, it would be a really good idea to replace them with something better than what you had before. Whether it be tooth-colored fillings or porcelain inserts that'll last you a lot of years, look very natural, have no mercury in them whatsoever. And that's my take on this. When you need silver fillings to be replaced, don't replace them with other silver fillings.
Okay.
There's much better stuff that we have that'll serve you much better.
Mm-hmm. Right. I also have heard, and obviously since we mentioned the thermometer, mercury is used to measure the temperature, and mercury expands drastically, hugely in temperature. So I've heard that when the silver filling is huge, sometimes the poisoning is less of the problem, rather than because it expands with heat, it actually cracks your tooth. Is there some truth to that?
Oh, absolutely. We've noticed a lot of cracking underneath old silver fillings, even though if it's not noticeable. And that cracking can lead to having to put in crowns or even do root canals. It all depends on where it cracks. Some people are very lucky, some are not.
I see. All right. So don't put any new ones in it. Check out the old ones. See whether you maybe have a cracked tooth because of it. If you do, go and obviously fix it, because otherwise you're accumulating cavities below it, and eventually you will end up having a root canal and maybe even losing the tooth, and definitely need a crown.
While the old silver fillings are basically just shoved into the tooth, the new ones that we have are actually bonded, so there's actually a chemical bond that holds everything together, making it much more stable and will last you longer and much less sensitive.
And of course better looking.
Oh, yeah.
If that is anything which is usually they're in the back, so nobody really cares. But all right, good. So we shouldn't worry too much about it. What symptoms would a person get if he has a mercury poison? Just so that he goes, let's go and do some tests here, just in case a person experiences that symptoms. What would he get?
Usually people would get tired a lot. They would have memory problems. There is a whole list of symptoms that you have with memory, with mercury poisoning, but that would happen if you ingest a great amount of it. It wouldn't be just from a couple of fillings. The problem with the fillings most of the time is the cracking and the sensitivity and that type of stuff.
Right.
But in any case, again, as we talked before, prevention is worth a pound of cure. So see your dentist right away, and if you notice there's any old silver fillings that need to be replaced, you replace them.
Right. So there really is not all that much evidence about the silver really poisoning the people. It's more like a theoretical line. However, that mercury filling does have problems of cracking teeth, getting very sensitive, falling out, looking unsightly, name it. Hello?
Yes, I'm sorry, you've lost you.
Okay.
Hello?
Yeah. I was saying that there wasn't really... Can you hear me?
I lost you. Hold on a second. Oh, here you are. Okay, I lost you for a second.
Yeah, I think you just had a black screen, that's all.
Yeah.
Okay, so we'll do it. Your screen went black, right?
Yeah.
Yeah, you were still here. So
Okay.
I'll adjust that and put your yes. Say, just in case, say right now, yes, that's exactly what it is, and then we end off.
Yes. that is exactly what it is.
Well, all right. Again, thank you very much for your informative sessions here, Dr. Zhitnitsky. Bye-bye and all the best.
Thank you, Helmut.